It's estimated that over 50% of people diagnosed with IBS actually have SIBO. Maybe you're one of these people. Maybe you have IBS, but your symptoms just don't make sense. You're bloated even when eating safe foods. Your gut flares after a salad. No matter what you try, nothing changes. So what if it's not actually IBS? My name's David Watson. I'm an IBS specialist and I've helped hundreds of people with their IBS symptoms. In this video, I'm breaking down the key differences between IBS and SIBO and why so many people are misdiagnosed. So let's start with the basics. IBS, or irritable bowel syndrome, is a functional gut disorder. That means your gut looks normal on scans, but it doesn't quite work properly. You might experience bloating, gas, pain, changes in stool, whether that's constipation or diarrhea, or sometimes both. Now here is where it gets tricky. SIBO, or small intestinal bacterial overgrowth, has exactly the same symptoms. Bloating, gas, pain, and yes, you guessed it, changes in stool, so diarrhea, constipation, or both. So what is the difference? The key thing here is the cause. SIBO is a condition where there's too many types of bacteria or the wrong type of bacteria in the small intestine. This can lead to various digestive symptoms. So that's SIBO. In IBS, however, the causes are multifactorial. It can be gut-brain issues, it can be food intolerances, it could be motility issues. But here's the good news, unlike IBS, SIBO can actually be tested for. And that's what makes SIBO different. You can actually confirm it with a test, unlike IBS, which is only diagnosed by excluding other conditions. So what is the test for SIBO? SIBO can be diagnosed with a simple breath test, which measures the hydrogen and the methane gases after you drink a sugar solution. If you have SIBO and bacteria is growing too much in the small intestine, then it will ferment that sugar early and release a gas which is picked up by the breath test. Now, before you jump into buying a SIBO test, there are a few really important caveats. The first thing is the cost of a SIBO test. Private testing can range from £250 to £400. That's around $300 to $600 if you're in the US, which is pretty costly. The second caveat is just because you test positive for SIBO doesn't mean you don't have IBS. It's not either or. Many people still suffer with IBS even if they've treated their SIBO, which is why I recommend exploring all of the IBS treatment options first, not just diet, but the gut-brain connection, medications, and longer-term strategies. So all in all, when I'm treating IBS patients, I tend to ask if they can hit these three guidelines. First one is, have you been diagnosed with IBS before, so that we know that you've ruled out other conditions that also mimic IBS symptoms? The second thing I ask is, have you tried all of the IBS treatment options? Diet, medication, gut-brain connection, probiotics. And the third thing I ask is, do your symptoms flare even if you are eating safe foods? So I ask my patients those three questions in order to get a SIBO test, because otherwise there's no point spending all of that money just to get either a negative or either to get a positive, but then we have to work on your IBS symptoms anyway because they might be causing the majority of your symptoms. Okay, so let's say a patient comes to me, they hit all of those three. They say, David, I've been diagnosed with IBS. I've tried all of the IBS treatment options and I know that I flare when I eat my safe foods. What happens next? Well, first of all, depending on which country they're in, they'll get a home kit test sent to their address. The breath test is actually really easy to do and most people can just do it from home. Once completed over the course of a couple of hours, they send it to the lab and then the lab analyzes it and we review their results together. That's just how I do it, but obviously you can choose whichever nutritionist or dietitian you go with. Now, if they don't have SIBO, then we continue looking at IBS strategies that they may have missed. If the test comes back positive, however, then we can look at some SIBO treatment options. There are two main treatment options for SIBO. The first one is medication. You can take a short 2-week trial of rifaximin. This targets the overgrowth in the small intestine. You'll need a prescription for that from your doctor, and the cost of that is around £200 or $300. It can be effective short term, that antibiotic. However, you might have to retake it because it's not necessarily targeting why you had that overgrowth of bacteria in the first place, it's just eradicating it. So it's something that you might have to look at retaking every few months. The second treatment option is dietary changes. This can help manage symptoms, either in the short term or part of a longer term strategy. For example, previously I've created custom food lists for clients, which is loosely based on a low fermentation diet. The idea for that is pretty simple. If we reduce the fermentation in the gut, the chance for this bacteria to cause fermentation, then we hopefully reduce the symptoms. So all in all, SIBO and IBS aren't mutually exclusive. You can have both. And that's why it's important to look at the full picture before jumping to conclusions. Now, if you're wondering whether your IBS might be SIBO, then I do these free 15-minute calls you can book in the link in the description. We can have a look at your symptoms, your history, and whether treatment options might be worth exploring for you. Click the link in the description to book a chat. Hope that video helped, and I will see you guys in the next video.